Teaching children how to read series, language and literacy skills. This video is the continuation of part 2 of the developmental domains in children's early childhood education, namely language and literacy. Literacy domain refers to the reading, writing, and numeracy. Most children can understand what you are saying even before they can clearly talk. But some children may not be able to do the same. There are two kinds of language disorders, receptive and expressive. Children often have both at the same time. A child with a receptive language disorder has trouble understanding words that they hear and read. Children who have a language disorder have trouble understanding language and therefore will struggle in communication. A receptive or expressive language disorder is most likely a medical issue that can cause children not to understand what is being said to them. The cause of the disorder is unknown. Genetics and nutrition may play a role, but these explanations have not yet been proven. Normal language development involves the ability to hear, see, understand, and remember. This process may be delayed in some children, but who eventually catch up with peers. Problems with language reception and expression generally begins to manifest before the age of 3. Despite efforts and the child is not yet expressing her feelings or thoughts, it could be one of the following: that he or she is a late bloomer, has hearing impairment, or has expressive language disorder or other underlying cause of speech delay. The first course of action is to visit your doctor for a full physical examination. Some of the symptoms that may point to a language disorder are overuse of and because they cannot recall the right word, limited vocabulary compared to children of the same age, limited ability to use words and connect sentences to explain or describe simple things, limited ability to engage in a conversation, saying words in the wrong order, repeating a question while thinking of an answer, confusing sentences. Some of these symptoms are part of normal language development. It may be considered a language disorder if several of these issues are persistent. How can the child develop a strong receptive language to be able to have a strong expressive language too? Input like stories, songs, poems, games, conversation lead to the output, that is the development of language and literacy skills. The interactions you have with your children through conversations, singing, storytelling, games, and others will help develop the receptive and expressive skills necessary for the development of literacy skills. The more you practice, the stronger these connections become. Repetition and memorization enrich your input, which will lead to greater output. Neuroplasticity says that when you are learning, important changes take place in your brain, including the creation of new connections between your neurons. The child remembers through repetition and memorization. As you model and give examples, the child understands and will enable him or her to apply in reading, writing, and numeracy. Repetition is a necessary building block that creates and strengthens the neural connections in the brain that help the children remember and learn. When a child hears the same story or song over and over again, they remember them. Doing something over and over again makes things easier. Children participate because they can predict what will happen next in the story or the next line in the lyrics of the song. Parents modeling is one way in which a child's behavior is learned. This is also known as observational learning or social learning. As an elder talks or acts, the child observes, then imitate. As they grow, their language grows too, enabling them to put their thoughts, needs, feelings into words. Effective communication is necessary for forming relationships at school and in school settings. Early intervention plays an important role in a successful outcome. The common treatment for language disorder is speech and language therapy. The speech-language therapist will diagnose and treat your child according to their needs. Your child may participate in one-on-one treatment sessions with speech-language therapists or attend a group session. Speech therapists or pathologists are educated in the study of human communication, its development, and its disorders. They assess speech, language, cognitive communication, and oral, feeding, swallowing skills. This lets them identify a problem and the best way to treat it. The disorder is often treated through the collective efforts of parents, teachers, speech-language pathologists, and other health professionals. Language disorder, if not immediately addressed, can result to behavior problems until adulthood. Genes or our nature do not determine the child's destiny. The power of the hands that rock the cradle is the great determinant of the child's character. Success at home leads to success in school and in life. Next in TCHR series is part 3. Thank you for watching and please subscribe.